Thank you, Ian. Good morning, good afternoon, and good evening, based on where you're logged in from. I'm going to present to us the risk of antimicrobial resistance in relation to global catastrophic biological risks. And for this particular presentation, we are going to be interacting on a subject matter that we have all heard about so many times. And what we are doing here particularly is to keep bringing the same reminder on what all of us should be able to do to avoid antimicrobial resistance from becoming a bigger problem than what already it is. And antimicrobial resistance, we are basically looking at a situation where you have previously responding microorganisms that were responding to particular drugs, no longer now responding to those drugs, and you may need an alternative to be able to cure or treat any illness which has been caused by that same microorganism. Hey. Am I the one? Okay. All right. So with that brief definition, antimicrobial resistance is indeed it's growing into a global crisis. And when you read literature, based on the definitions that we had about global catastrophic biological risks, there is a school of thought that thinks antimicrobial resistance does not qualify to be categorized under the GCBRs or even near GCBRs. But we know that if there are any indicators that are not addressed, then you could end up with a much bigger problem than anticipated. And the reason why some school of thought thinks this is not as big a problem is because it is estimated that you may need up to about 35 years for you to realize a global death of about 10 million people per year. And so according to the definitions and the statistics that were shown in reference to global catastrophic biological risks, this could not probably fit there. But it is important that we look at it because it is indeed a big problem currently, and it could get even worse. And when you think about it broadly, in case we do not deal with such a problem and we get into a post-antibiotic era, there are more problems that are bound to happen. For example, someone would not easily take on the simple surgeries like for example, the cesarean sections, chemotherapy, because all those have been successful because we have had antibiotics to use. So that makes it very important to pay a lot of attention to this when we are talking about the global catastrophic biological risks. So it is expected that by 2050 we would have about up to 10 million 10 million deaths per year, which would also have an effect on the GDP by 2 to 3.5%, estimated at a global cost of up to USD 100 billion. But we know that this greatly affects the productivity of the patients and the caretakers. So with antimicrobial resistance, we get to see longer stays in the hospitals by the patients. We have the burden of those patients on the caretakers, and in so doing, this cannot be able to go out and engage in productive activities. So I would like us to pay attention on this, this particular map. So by 2050, this is a representation of the 10 million expected deaths due to antimicrobial resistance. But you can see, when you look at Africa and Asia, you can see that they are contributing the biggest, they would be contributing the biggest numbers to this statistic. But what do we know about this very continent? It's where we are coming up with the least innovations. It's where we have the least investment when it comes to medicines. It's where we have the least capacity built and the expertise to do, to put in place the strategies that would be able to address antimicrobial resistance. So what does this mean? Today we are in the right place in this room, and it's important that we take seriously some of these issues and see how, before the 2050 comes and we see these statistics unfolding, we can be in position to do something about it. And I would like to affirm that I believe we are on the right track. This graph also gives us a picture on the development and evolution of resistant bacteria vis-a-vis the antibiotics, the new antibiotics that were ever developed. So we can see that as years have gone on, into the 2000s, the blue bars are representing the antibiotic deployment, so the development and the deployment, and the red bars are representing the antibiotic resistance. So we can see that the bars have become shorter and shorter, meaning that even when new drugs are deployed, within a few years, we already have organisms that are already resistant to them. And me and you have know that it's been long since we ever had any new antimicrobial agents come on the market, save for the few antibiotics and other antimicrobial agents which have always been either repurposed or we have had them a bit changed to serve the purpose. Oh. So that, seeing such data, getting such information should be able to, stir the need within us to do something about antimicrobial resistance. Is it coming? Yeah, sure. So we have looked at what is expected with time. We have seen what the trend of the development of the new antimicrobial agents has been. But what is the current situation as of now? So we have drug resistance in bacteria, and based on the global antimicrobial resistance and use surveillance system, we have information that up to 8.4 to 92.9% of E. coli and 4.1 to 79.4% of Klebsiella pneumoniae in some of the countries that reported were resistant. We have drug resistance in TB, and here in 2018 it was estimated that up to 3.4 of new TB cases and 18% of previously treated cases had become multi-drug resistant. Drug resistance in viruses. From the earlier discussions, we saw that viruses pose a higher risk of probably causing the next pandemic, and we've seen this previously. Most of the pandemics that we've had, the epidemics that we are having, they are due to the viruses. But particularly here, like in HIV drug resistance, there has been a report of up to 10% of people who had never been on treatment to have already had to have HIV that is resistant to the non-nucleoside reverse transcriptase inhibitors. And it's worse in children, especially in sub-Saharan Africa, where we have up to 50% of the infants carrying a virus that is resistant to the non-nucleoside reverse transcriptase inhibitors. Malaria, we've had malaria resistance for a long time, and that's how we end up with the artemisinin combination therapy. But this is also said to be spreading. The resistance is also said to be increasing. We are only glad that there has been studies on malaria vaccine, and there is one that is already being deployed. Hopefully, it can be able to counter some of these issues. Then drug resistance in fungi. We appreciate that we have very few mycologists, even within, if I asked any of us to mention the mycologists that we know, I'm sure you would count them on your fingers. And there is equally not so much data on fungi as there is like on bacteria. No wonder the WHO is now undertaking a comprehensive review on fungal infections globally, and they hope to as well publish a list of fungal pathogens of public importance. And that would be able to, with an analysis of the antifungal development pipeline. So we saw that for the antibacterials, but then we would also be interested in this because we are seeing a lot of fungal infections that are very, very hard to treat as of now. As of May 2022, we had 112 antibacterials in the clinical development pipeline. But this is, you can see that for these clinical trials, as you move on from phase 1 up to the approvals and then the marketing, we can see that the numbers keep reducing. Literature has it that of about 5 drugs that will get into the clinical trials, it is always only one that will end up being deployed. And I think this is data that we can see from. And we can see that the products addressing priority pathogens, those are majorly the bacteria as per the WHO list. On marketing, we have 11 of those. For tuberculosis, we only have 1. And the products addressing clostridioids, it's 0. On this list, we can't see the fungi that we're talking about. So you would wonder, so what is happening with the people who are developing resistance to, who have fungal infections that are already resistant to the existing agents? The problem is indeed big, that when we look at the SDGs, we have a number of those that are affected by antimicrobial resistance. When you're sick, you're not going to be able to cultivate if you depend on farming. And the next thing, there is going to be hunger. Definitely the issue of health. We have antimicrobial resistance, like the drugs in the food chain, so that ends up in the seas, in the environment, and all that. So these are some of the common causes of antimicrobial resistance. We are probably all familiar with this. Self-medication. Very many of us must be guilty of this. It's worse in low-income countries, because we realize that in most of the countries, for example, I would give an example of Uganda, which I'm so familiar with. We don't have the health insurance like for everyone, apart from the few people who are maybe like the insurance is being paid for by their employers. So the rest of the people have to find a way, in case they fall sick, to treat themselves. And healthcare turns out to be extremely expensive, that very few people can be able to afford those costs. So what do? Once they fall sick, the first thing everyone knows, that must be malaria. So they run to the what? To the pharmacy, get the antimalarials. They don't work. When they continue being sick, they'll now start saying that is infection. Whatever infection, they know the antibiotics that treat those infections. So they will go and get all sorts of drugs to use when they are sick. And at the end of it all, someone has been exposed to all different classes of drugs, right from the first line drugs to the second line drugs, and sometimes sometimes like the regulations, even for prescription only drugs, like people can be able to access them, and you end up finding people misusing this. So we have overprescription, lack of rapid laboratory tests encouraging empirical treatment. I think this takes us to the technologies that would need to address some of these issues. When you talk to a number of physicians, they'll tell you that when they send samples to the lab for culture and sensitivity, for them to be able to come up with the right drugs to give the patients, they'll tell you how that takes so long. And what does that encourage? People end up prescribing drugs empirically. Then we have patients not following prescription. When someone starts feeling better, they stop taking the medication. Use of antibiotics in agriculture, unnecessarily poor infection control in hospitals and clinics. We have poor hygiene and sanitation. So there have been efforts to address AMR. We have probably been a part of this. And here we want to look at the role of the World Health Organization. And particularly, we see that there is the Global Action Plan on Antimicrobial Resistance that was endorsed at the World Health Assembly in 2015. And this gives a bit of framework for the different nations to come up with their own plans on how they would be addressing antimicrobial resistance. These are the key areas of the Global Action Plan. So we have improved knowledge and understanding of AMR. We were given a very interesting session on risk communication. It is very, very, very key. Then we have education, enhancing knowledge through surveillance and research. Without the right information, we could end up making the wrong decisions. So being able to collect the right data and using that data to make decisions is very, very important. Then reduce incidence of infection through effective hygiene and IPC measures. Optimize use of antimicrobials in human and animal health. And then assuring sustainable investment through research and development. On the African continent, I don't know what the case is for North Africa, but we have challenges when it comes to investment in healthcare. So many times when the budgets are read, there could be a considerable allocation towards healthcare. But then along the way things change, and it is unfortunate that sometimes you find cuts happening on the same budget. It's really, really quite embarrassing. So in reference to surveillance, the WHO launched the Global Antimicrobial Resistance and Use Surveillance System, abbreviated as GLASS. And this promotes standardized collection, analysis, and reporting of AMR antimicrobial resistance data. The objectives of this system was to foster national surveillance systems, analyze and report AMR data on regular basis, help to estimate the extent and burden of AMR by particular indicators, detect emerging resistance and international spread, also inform implementation of targeted prevention and control programs, and finally to assess the impact of those interventions. Very interesting here. So this, the map shows us the different nations that have been enrolled in this, in the system, for them to be able to submit information on antimicrobial resistance and antimicrobial consumption. And as of today, we have 109 countries that are subscribing to this. However, very important to note is only 19 of those 109 countries enrolled for both antimicrobial resistance and antimicrobial consumption. So that means the remaining 90 countries, they do not provide information when it comes to antimicrobial consumption. You would never know whether they are consuming much more than they should be. So we have enrolled in antimicrobial resistance. We have then we have those that are only enrolled in antimicrobial consumption alone. Those are only 2. Then there are also countries that are not enrolled. So with that, with the efforts that the WHO has had, and so many that we have contributed to, they have come up with a list for the priority pathogens for research and development of the new antibiotics. I'll not necessarily go through all this, but the other thing I would like to still say, this list talks to the bacteria, but we have fungi, we have the viruses that need to as well be looked into, because we can see increasing trends of resistance. So what can we do to deal with this? Indeed, there is need for multi-sectorial approach. We've been preaching the gospel of One Health, and indeed we shouldn't leave anyone behind, because we can see that antimicrobial resistance could move from the environment to the humans to the animals. So if we work in silos, then all those are efforts which are wasted. Then there is need for innovation and investment. As I earlier said, there are very, very few drugs that are coming on the market. As of now, they are estimated to be only 6 that are yet to come on the market that have a bit of innovation in them, like they are a bit new, so to call them. But the majority of the drugs, they are already existing, and so they are altered to serve the purpose. And what that does is, most of the times, the organisms will, within the shortest time, become resistant to those agents as well. Then there is need to improve laboratories, build capacity to test and choose the right drugs. We were talking about accreditation. We just talked about accreditation here. So building the capacity of the labs, how can we ensure that the labs are actually doing quality work, they are producing quality results which are timely, such that the clinicians who want to use these results to manage the patients are able to get the results in time, and then they manage the patients in time. Then collect and share the data. From the previous discussion of the countries that are submitting the data to the GLAS, there are some countries that are not. But even inherently, what is the quality of the data that we are submitting? Is it quality data? Is it comprehensive data? Then we have AMR stewardship. There are persons who could be managing patients, but when you talk about, there is a study that revealed that there were some clinicians, they know about antimicrobial resistance, but they think that their own practices were not contributing towards antimicrobial resistance. So you be there and then think it's some other person's problem. It's someone else who is doing something wrong. But it's important that we all become stewards of AMR, and that could help us in enforcing the efforts towards addressing this. Then we need to take measures to prevent infections. For example, the infections prevention and control in the health facilities is very, very critical. We have people who come into our health facilities. Maybe they have come in with a different ailment, but they live with something else, and probably due to a resistant organism. So what role are we playing to ensure that this does not happen? Infection prevention and control definitely becomes very important at this level.
Maybe I want to make a comment about the, MR, what you call it, cartography you show. Actually, in Niger, since I think more than 2 years, we have a national reference lab for MR. And also they develop a guideline, national strategy for MR. Okay. So maybe you can update this. And also, African country, most of them, they have a new challenge, that is security. And that has a lot of impact on health, resource allocation. So my own opinion, maybe if you consider health security, GCBR maybe as a security, challenge implicating the military, maybe we'll have a consideration will be given to this aspect by, government.
Thank you so
much. Good morning, everyone.
Good morning.
Yeah. Sandra, thank you so much for the presentation. I have a few inputs that I want to make. I want to say that antimicrobial resistance is becoming a very, very challenging issue. And really we need to come up with strategies that will help us out of this problem. I come from the vet side, and I've practiced veterinary medicine for quite some time. There are a lot of challenges that I've observed. One, we treat animals as vets, and also the farmers treat the animals. But there's that period during which, at least, it's called the drug withdrawal period. What happens is that the farmers cannot wait for that. As you are treating the animal, then they are milking and drinking the milk. And I think you all should know that the drugs that we use in animals are the same as the drugs that we use in people. Oxytetracycline, penicillins, and what? They are the same. They are not different at all. And we use them in much more larger quantities compared to human beings. And they end up in the meat, they end up in the milk, and then we end up consuming these things. You understand? Secondly, poultry. We want our birds to grow very fast so that we don't make losses. And from day one, what do? We feed them on what? On antibiotics. You see? E. coli is one of the issues that we encounter in poultry. You understand? Salmonella. And those are the ones that we also treat in human beings. So we every day take in antibiotics, if you don't know people, from what we eat. And antibiotics have also been detected in plants. You see? That's where the challenges are. So I think we need to really find ways of, I don't know how to go, because now for animals it is commercial. It's money. You see? So those are my inputs. Thank you so much.
Thank you, Sandra, for this presentation. And you highlighted a very important issue regarding the antimicrobial resistance, and this is one of the global challenges. Regarding the issue is very important, and sure it needs One Health approach, because it is very complicated issue, and there is many stakeholders play or affect these issues, like Dr. Robert says. So we don't focus only on the public health sector or the human health sectors, because it should be involved the animals, because I think the animals is problem maybe contribute more than 60% of this problem. And also we should consider the plant health. This is or environmental issues. So we should focus on the holistic view of the issues. As Dr. Robert say, yes, I am, because I am also veterinarians, I am in a line with Dr. Robert 100%, because practice, and you are highlighted this in your presentation, that we need to focus on the agriculture using of antibiotics, either for veterinarians or for farmers or etc. So we need broad and responsible use of these antibiotics. Yes, there is some alternatives in the veterinary fields, at least, because I am convenient with this, like probiotic, prebiotic, symbiotic, and ultrabiotics, something like that. This is considered as, by some way, as alternative, indeed not yet as effective as the antibiotics, and not yet present 100% in the normal practices of raising the birds or raising the large animal. But this is one way on the right side. It is the alternative for the antibiotics using, and by some way using both, using, for example, probiotic, and just after using the antibiotics. So generally, we need to get the One Health approach on this, and the very important point, I think the first point, is raising the awareness at the very different levels. I mean, for the public health, and maybe in the media, either in TV, radio, it depends on where we are, and maybe Facebook, etc. We need to raising awareness of this, because you mentioned that one of the first cause of this problem is self-medication. Self-medication, yes, mainly based on your lifestyle or the poverty or something like that, but also we need to raise awareness to avoid this cause. The awareness not only for this public, but also for the technicians, either in the human, doctor in the human or public health, or in the veterinary sectors, or in the animal sector. So this is one side, and you enumerated in details the other regarding the innovation, and in the private sector we need R&D working on this. But the question arises is that, what is the motivation for these companies to work in this? Because this company, when decided to pay billions of dollars to develop new drug from scratch, this consume billions and consume times. So as a businessman, what would let you motivate to make something like that? This is very important. We need discussion at the higher level, and this is highlight as a point of presentation of Ian, the cooperation between the public and private sectors. We need this in this sector. So thank you so much for your presentations.
Thank you so much.
Maybe one thing, that we are observing situations where we're also getting poor quality drugs on the market. I don't know if you mentioned that, but this has been observed, that it could be one of the factors which are contributing to this. You understand? Then, in the same line, because of fake products on the market, we are seeing in livestock what we call pest or acaricide resistance. The ticks are no longer responding to, these acaricides in Uganda. I don't know if it's even in other countries. But authorities have found out that it's because of some of these, it has been due to fake acaricides on the market. And this will, in future, increase the population of what? Of ticks. And ticks have also, they are involved in the transmission of so many diseases to people. So we need to have a holistic approach to this resistance of acaricides, of antibiotics, and things like that. Thank you so much.
Thank you. I would like to maybe add to what Dr. Ali talked about when it comes to the motivation for the different companies to develop these drugs. Actually, from the literature that I looked at, the new drugs that we are looking at, they are not being developed by the big R&D companies that we know, like the companies that are already established. They are startups that are doing this. And why? Because the big companies are not seeing the reason why they should be developing these particular drugs. And so one of the ways that they are getting some of these startups like to work on the drugs, there are trusts that are being established with different funding from, like, pooling resources from the different sources to be able to support these small startups to develop the drugs. So I think that I look at it as one of the promising strategies, but I believe there is much more that needs to be done. Otherwise, the problem is indeed a huge one. Thank you.
If I could just follow on from Dr. Magid's great comments there. I noticed you had infection prevention and control as one of the approaches we can take towards addressing this problem of growing antimicrobial resistance. I think this is particularly important in the field of zoonotic diseases, and where you have vector-borne zoonotic diseases like CCHF with ticks, or any of the other tick-borne diseases. I'm trying to think whether it also applies to mosquito-borne diseases, but when you talk about infection prevention and control, are you talking at the institutional level within a hospital or similar facility, or are you talking at a national level of creating a national plan for infection prevention and control, starting with the agriculture and the agricultural workers and their contact with the animals, the veterinary services, but also going into the hospitals and the whole human health side? And of course, in CCHF, you also have the food handling, the meat handling business, and the leather business. Anyone who handles the products of the animals, we need to bring them into the infection prevention and control as well. Is that what you had in mind when you said that, or was it something more specific?
Yes, so we are looking at, it's exactly how you've said it. We are looking at how can we have strategies at national level in relation to infection prevention and control. And of course, we appreciate all the different levels at which would have crossing over of the, different infections, as you've well stated, if we do not address this. The example that I gave was a particular one, but we need to look at it like holistically, much as I referred to one when it comes like to the different institutions like the hospitals. Thank you.